Pulmonary edema is a condition caused by an accumulation of fluid in the lungs. This fluid accumulates in the lungs' numerous air sacs, making breathing difficult. In most cases, pulmonary edema is caused by heart problems. However, fluid can accumulate in the lungs for a variety of reasons. These include pneumonia, exposure to certain toxins, medications, chest wall trauma, and traveling to or exercising at high elevations. Symptoms. Symptoms of pulmonary edema can appear suddenly or gradually. The symptoms vary depending on the type of pulmonary edema. Symptoms of acute pulmonary edema: difficulty breathing problems, dyspnea, or severe shortness of breath that worsens with activity or when lying down. Suffocation or drowning sensation that worsens when lying down. Coughing that produces frothy sputum that may contain blood. Palpitations are rapid, irregular heartbeats. Anxiety, agitation, or a sense that something bad is about to happen. Skin that is cold and clammy. Wheezing or panting for air. Signs and symptoms of long-term, chronic, pulmonary edema. Waking up in the middle of the night with a cough or a shortness of breath that can be relieved by sitting up. Difficulty breathing while moving or lying flat. Fatigue. Increased shortness of breath when physically active. New or worsening cough. Gaining weight rapidly. Leg and foot swelling. Wheezing. Signs and symptoms of high-altitude pulmonary edema, HAPE. Adults and children who travel to or exercise at high altitudes may develop high-altitude pulmonary edema, HAPE. The following symptoms are similar to those seen in acute pulmonary edema. The first symptom may be headache. Shortness of breath during activity, followed by shortness of breath at rest. Inability to exercise as much as you once could. At first there was dry cough. Later, a cough that produces frothy sputum that may appear pink or contain blood. A rapid heartbeat, tachycardia. Weakness. Chest ache. Afebrile fever. High-altitude pulmonary edema, HAPE, symptoms tend to worsen at night. Causes. Pulmonary edema can be caused by a variety of factors. Pulmonary edema is classified into two types based on where the problem begins. Cardiogenic pulmonary edema occurs when pulmonary edema is caused by a heart problem. The most common cause of fluid buildup in the lungs is a heart condition. Non-cardiogenic pulmonary edema refers to pulmonary edema that is not caused by a heart condition. Pulmonary edema caused by the heart, cardiogenic edema. Pulmonary edema can sometimes be caused by both a heart problem and a non-heart problem. Pulmonary edema caused by the heart, cardiogenic edema. Increased heart pressures cause cardiogenic pulmonary edema. It is usually caused by heart failure. When a diseased or overworked left lower heart chamber, left ventricle, is unable to pump out enough of the blood it receives from the lungs, heart pressures rise. The increased pressure forces fluid into the air sacs through the blood vessel walls. Medical conditions can cause heart failure and pulmonary edema. Coronary artery disease. Coronary artery disease is a type of heart disease. The arteries that supply blood to the heart muscle can become narrowed over time due to fatty deposits, plaques. The left ventricle can be weakened by a gradual narrowing of the coronary arteries. A blood clot can form in one of these narrowed arteries. A heart attack occurs when a clot blocks blood flow and damages part of the heart muscle. A damaged heart muscle is unable to pump as efficiently as it should. Cardiomyopathy. This phrase refers to heart muscle damage. Cardiomyopathy causes the heart to work harder and raises blood pressure. The heart may then be unable to work harder when required, such as during exercise, an infection, or a rise in blood pressure. Fluid backs up into the lungs when the left ventricle cannot keep up with the demands placed on it. Heart valve problems. Blood flow into the heart is affected by narrowing, stenosis, of the aortic or mitral heart valves, or by a valve that leaks or does not close properly. A sudden and severe pulmonary edema could result from a valve leak. High blood pressure, hypertension. Untreated or uncontrolled high blood pressure can cause heart enlargement. Other heart problems. Inflammation of the heart muscle, myocarditis, congenital heart defects, and irregular heart rhythms, arrhythmias, can all cause pulmonary edema. Kidney disease. Pulmonary edema can be caused by high blood pressure caused by narrowed kidney arteries, renal artery stenosis, or fluid buildup caused by kidney disease. Chronic health conditions. Thyroid disease and iron, hemochromatosis, or protein, amyloidosis, buildup may also contribute to heart failure and pulmonary edema. Non-heart-related, non-cardiogenic, pulmonary edema. Non-cardiogenic pulmonary edema is pulmonary edema that is not caused by increased heart pressures. Non-cardiogenic pulmonary edema can be caused by acute respiratory distress syndrome, ARDS. This life-threatening condition occurs when the lungs suddenly fill with fluid. Acute respiratory distress syndrome, ARDS, can be caused by a variety of conditions, including severe injury, trauma, widespread infection, sepsis, pneumonia, and severe bleeding. Drug reaction or drug overdose. Many drugs, from aspirin to illegal drugs like heroin and cocaine, have been linked to pulmonary edema. Blood clot in the lungs, pulmonary embolism. Pulmonary edema can be caused by a blood clot that travels from the blood vessels in the legs to the lungs. Exposure to certain toxins. Toxins inhaled or stomach contents inhaled while vomiting, aspiration, cause intense irritation of the small airways and air sacs, resulting in fluid buildup. High altitudes. Mountain climbers, skiers, hikers, and other people who travel to high elevations, usually above 8,000 feet, about 2,400 meters, have been seen to develop pulmonary edema. High-altitude pulmonary edema, HAPE, typically occurs in those who do not spend the necessary days or weeks acclimating to the elevation. People who live at high altitudes, on the other hand, can get HAPE even if there is no elevation change if they have a respiratory illness. Near drowning. Water inhalation causes fluid buildup in the lungs. Negative pressure pulmonary edema. Trying to breathe through a blocked upper airway creates negative pressure in the lungs. Most people with this type of pulmonary edema recover in about 24 hours with treatment. Nervous system conditions or surgeries. Neurogenic pulmonary edema is a type of pulmonary edema that can occur after a head injury, seizure, or brain surgery. Smoke inhalation. The chemicals in fire smoke damage the membrane between the air sacs and the capillaries. Fluid can enter the lungs due to the damage. Transfusion-related lung injury. Blood transfusions can result in fluid overload in the left ventricle, which can lead to pulmonary edema. Viral illnesses. Viruses that cause pulmonary edema include the hantavirus and the dengue virus.